Let me just call to the stage the panel. So Dr. Shannon McDonald, Dr. Nadine Kieran, Jonas Espero Crawford, Colleen Erickson, Kim Brooks, and Grand Chief Doug Kelly. And while I introduce our MCs for this session, we've heard throughout the day that really the work that we do here really depends so much on connection. And I have a personal connection to each of our MCs for this event. Due to the number of cancer incidents in my own large family and a number of losses, I participated in the Ride to Conquer Cancer, and I've done 5 of those rides. So thank you. As a part of that, the BC Cancer Foundation, which supports the BC Cancer Agency, also does some running events. So I started to do those as fundraisers for cancer. Our first MC, Beverly O'Neill from the Tunaha Nation, is an established marathon runner herself, having run 22 marathons, and she taught me how to run marathons, and so that's how we connected, so I wanted to thank her for that. You may also recall that not long ago, the Vancouver Native Health Society did a promotion on cancer screening and did some posters, one on a number of them. The one I did was on prostate cancer. And so everywhere I go in the provinces, the chiefs will happily say, hey, we have your poster in our bathroom. To which I say, perfect spot. And so we did that, and then our co-MC, Michael Eisen, is actually a good friend of ours and an author himself. And so he has a book, Finger Up the Bum, A Guide to My Prostate Cancer Journey. And he points out that it's important to read the entire title of that book, lest there be some confusion. And he is in himself, as a result of that, a living example of the advances that have been made in the treatment, just given the work that he's done to deal with that particular illness. So please help me welcome Beverly O'Neill and Michael Eisen. And there's your remote control.
Wow, I kept my glasses on so I could see all of you guys. And what an honor to be with you guys today. But before we get started on this, on behalf of the panel, we want to express our greatest and deepest appreciation to the First Nations whose territory we're on, the unceded territory of this Squamish, the Tsleil-Waututh and the Musqueam. Thank you very much. You guys have always been gracious hosts, and it's our distinct honor to be with you today. Greetings, they said I'm supposed to read from this. By the way, I'm doing a comedy show at the Elders Conference next month, and they've told us not to use the F word. And I said, what, you mean feeble? Don't say fantastic or fabulous? So Harold actually missed the part. He said I did 22 marathons. I only did 20. I want that to be clear. I've only done 20. But add to that the fact that I actually didn't teach him to run. I was actually running after him. Woohoo! Apparently, I actually have a lot of husbands. Michael might be one of them, so it might be more like a harem.
Might be.
Or it could be a himum, I'm not sure. You guys, we've got a really difficult topic to talk to you about. Some of you might know it as the C word.
You mean cute?
No, Michael, we're not talking about you.
But you're the big C.
Yeah. Callous?
Well, you mean you're not talking about me.
No, I guess you're talking about me. So we have our own way of talking about cancer, because I know it's a very difficult topic. It's a very difficult conversation to start and to have. I want to first of all tell you a little bit why I'm here and wanted to talk about cancer. Make sure that this is a part of your panel. A number of years ago, when I was 46. I knew I needed to go in for and by the way, I call them pancakes. Michael calls his
spaghetti and meatballs.
That's the way we talk about it. This is the way we talk about cancer. But when I was 46, I went for a run, and I came across a breast cancer van over at Falls Creek. And I knew I needed to go in for my breast cancer. I call it the biannual pancake boob squeeze. And I want to thank BC's medical system, because without medical, nobody would be touching these. Yeah, this is I get action twice a year now. Breast cancer in the annual, I call it poke, prod, and feel. So anyways, so I stopped in at this van. Not only did I get a recipe card for tomato soup, I also got a file and a nail file, and I booked my first appointment for my biannual pancake boob squeeze. So I went for my test, and I thought everything's going to be great, because like Harold said, I run, I think I eat healthy most of the time. I am actually a popcornaholic too, so I eat a lot of popcorn, and generally I live a pretty boring life. So I went in, I went for my test, and 2 weeks later I got a phone call and said, Beverly, you need to go back in for more exams. How shocking that was for me, that I had to go in for more, because I didn't expect to be someone that needed to go in for more testing. So I went, and on the way over, I remember thinking, what if I don't get to have gray hair? What if I have cancer? And I realized that growing old and getting gray hair is actually a distinct honor. So for those of you that are pulling them out, stop pulling out your gray hair. Anyways, it was difficult. Turned out things were clear. It's a process that you go through. Sometimes it's scary, but mostly it's important to go through. But cancer really hit home 2 years ago when my sister called, and she said, Dad has cancer. And for any of you that is half Irish, you'll be thinking probably what I was thinking. This doesn't happen in our family. Nobody in our family gets anything serious. Nobody in our family gets anything terminal, because if someone got anything serious, it would make somebody happy in our family. Because cancer is a tough thing, and to talk about this, I always believed that in our family we were going to live forever, because if something ever serious happened, it would make someone else too happy. So it would turn out my dad did have cancer. So imagine being the daughter that takes her dad to see the lawyer for his will, and the daughter who has to help her father out of the car because he's too weak to get out and he's in pain. The dad that for years always believed that men are always to be strong. The conversation I had with my dad is very different than the way Michael and I talk to each other. You'll hear us making fun of each other, poking prod. The conversation I had with my dad was, Dad, I hear you have a doctor's appointment this afternoon. I can go with you. And my dad didn't want to talk. He goes, none of your business. I don't want you there. So I said, Dad, I've written some questions down for you. Would you like my questions? He goes, no, I have my own questions. I don't need you there. And I said, Dad, I know you're in pain. Have you talked to the doctor about medical marijuana? That is a question I asked my dad. He goes, I'm not going to talk about that. So he didn't. And he went to the doctor's appointment on his own. And when he came home, he said, that was an awful appointment. It was e-health. I didn't have a time to ask any questions. And he goes, I wish you were there. And that was a conversation with my dad. My last conversation with my dad was on his 76th birthday. I decided the conversation with my dad was going to be the way we always had conversations. And that was he and I were going to fight, because that's the way my dad and I talk. So he told his sister he was 77. I said, Dad, you're 76. He goes, I'm 77. I know how old I am. I said, you should know. Not my fault you can't do math. He goes, I'm 77. I said, Dad, you were born in 1940. It's 2016. That makes you 76. He goes, you have to count the first year. I said, you don't count gestation. Come on. So later on, he told my mom, he goes, Mom, Joan, come here. Your daughter and I had a fight. Notice how parents always say, your daughter? That's the way my dad said, your daughter and I had a fight. My mom goes, yeah, I know. And he goes, yeah, she said I was 76. I said I was 77. And you know what? She was right. And that was my way of my dad apologizing. And I felt bad, because he didn't get to be 77, but he passed away a few months later in his 77th year. So our conversations aren't always easy when we talk about cancer, but they have to be a conversation that makes sense for you.
Thank you, Beverly, and I know how much you struggled with your dad the whole time, both having the conversations with him and getting him to talk to you. But I know he was a lucky man that you were there by his side. So thank you very much. So as Harold mentioned, I wrote a book called, oh, you can see it there. Where's the camera? Finger Up the Bum, A Guide to My Prostate Cancer. So can I get a show of hands from everybody? Who's had a finger up the bum? Go on. Oh, look at those hands. Great, great, great. Yeah. Great, great. Well, another show of hands. Who's had it for medical reasons? All right. There's no judgment here. There's no judgment here. 8 years ago, I experienced what I like to refer to as softwood lumbar issues, if you know what I mean. And I would go get it checked out. So I went for the finger up the bums, and one doctor liked it so much, he passed me on to a friend of his and another friend. So I was popular for whatever reason. But it worked out, but there was a problem, and it wasn't getting identified, it wasn't getting resolved. So they sent me for a biopsy of the prostate. And I don't know if you ever experienced anything like that, but Mr. Grabby goes up the back door to take samples, and not a very pleasant experience at all. But the results of that test, they diagnosed me with advanced and aggressive prostate cancer and said I had a 60% chance of making it to 50 years old. I was 45 at the time. But that was 6 years ago, and even according to my math, that's doing pretty good. Thank you. I immediately had surgery to remove my prostate, unfortunately, along with some other tubes and nerves that I really was hoping that they'd keep. I had hormone therapy, which is also known as chemical castration. And all that worked for a while, but then it didn't. And then I had some radiation to my strike zone and some more hormones. And that worked for a little while too, and then it didn't. Eventually it spread to my liver. And at that time, cure was off the table, and my doctor said to me something that I'll never forget. He said, people in your condition last on average 1 year. But that was 2.5 years ago. Thank you. I get applause just for being here. It's pretty good. I think in part, I lasted so long because every time I do one of these speaking engagements, my doctor gives me another 6 months. But really, I've been on the forefront of advanced treatments. They conducted a genetic testing of my cancer, found I have what's called the BRCA2 genetic mutation. It stands for something I have no idea what, but it gave me access to some targeted medications that has really allowed me to live this long. And in that time, I wrote the book, I went on tour, I talked to support groups, I talked to funders, I talked to the media, and because I think communication is really key to this. But the cancer doesn't care. It's still growing in my liver. It last year moved to my spine, so I had a little more radiation. And more recently, I've got 7 new spots in my brain. Last week, I thought I would go to my doctor and say, okay, we'll take one last round of chemo. But my wife and I and my doctor decided, no, this is it. I'm done my treatments. Whether I have a couple months, some months, a few months, a handful of months, I'm going to ride it out the best way I can. Because even with discovery, even with cutting-edge treatments, it doesn't always equal a cure, and in no way does it mean you'll live forever. But you know what? Extra time is gold. Time is something money can't buy. And I said to my wife 2.5 years ago that when we got the 1-year diagnosis, the 1-year prognosis, 3 years, that's all I want. If I could last 3 years, I'm a happy man, and this fall it'll be 3 years. Thank you.
As Harold said, Michael is truly a testament how advances in cancer research has been able to extend someone's life, but also give them a quality of life. So we're grateful for that. This afternoon, we're going to talk more about cancer.
Okay, we're thrilled to see so many of you here to support the ongoing conversation about cancer prevention and screening. We'll be joined today by a panel of speakers, including healthcare experts, representatives from the First Nations Health Council, the Health Authority, and the Health Directors Association, as well as a cancer survivor from Musqueam Nation. This afternoon, we'll share findings from a joint research project with the BC Cancer that looked into the incidence and survival rates of commonly diagnosed cancers between First Nations and non-First Nations people, and the importance of screening and what you can do to protect yourself and the loved ones in your communities.
So we're going to introduce all of our panelists first, and then once we get rolling here, we're going to keep going here. So our first panelist is Dr. Nadine Kieran. She's Ojibwe from Kamloops and was the first Indigenous woman to graduate with a medical degree from the University of British Columbia. Wow. She is a practicing surgeon, unlike all of those lawyers out there that said, I never practiced because I knew what I was doing. She is a practicing surgeon in Prince George, where she is currently the co-director at UBC Center of Excellence in Indigenous Health.
This is sort of like the Oscar nominations, right? We described the film. We'll also be joined, or nominated, joined by Dr. Shannon MacDonald, the First Nations Health Authority's Acting Chief Medical Officer. Dr. MacDonald is proudly Métis Anishinaabe with deep roots in the Red River Valley of Manitoba. I'm from Winnipeg, so woo! And she's a trained physician with the postgraduate medical training in community medicine and psychiatry, and has worked for over 20 years in First Nations and Aboriginal health. Welcome, Dr. MacDonald.
Like Michael says, it feels like the Academy Award. I just want to know, do I get to take the little man home? Okay. As Michael also mentioned, we have another person sharing their personal story. And from the Musqueam Nation, that's Jonas, Espero. She is a breast cancer survivor and a screening champion from the screening champion. Jonna has a unique story. She went to one of her members, her friend in the community, encouraged her to go and check out the mammogram van. She went to support her friend, and instead, she was the one detected with cancer. So bring a friend, and the outcome can change your life, can save your life. So join me in welcoming Jonna.
And finally, Grand Chief Doug Kelly, Chair of the First Nations Health Council, Colleen Erickson, Chair of the First Nations Health Authority Board of Directors, Kim Brooks, President of the First Nations Health Directors Association, who are all here to announce an exciting new cancer screening campaign launching today at Gathering Wisdom, or GWIX, as I hear it's called now.
Yeah, because Harold was being funny. GWIX. I thought it was, I actually did agree, I agree with him. I thought it was Gitsen. Okay. That must be the table of Gitsen people over there. Yes! Ready to go! Woo! So we've got a great panel of speakers today that's going to give you insight into cancer and how we can end the stigma around this disease and reduce the fear that many of us have when it comes to having these conversations. As I mentioned, the conversation can be a very tough one to have, but it needs to be a conversation that you have in the manner that works for you. As you notice, Michael and I laugh and we joke a lot. The conversation I had with my mom and my dad were very different. With my mom, I sat with her and told her her husband is dying. But it is a conversation you have to have sometimes. So our first speaker will provide an overview of some of the data and recent cancer research and the information that was gathered on colorectal, or as Michael likes to call it, finger up my bum, on colorectal, breast, and cervical cancers. Join me in welcoming Dr. Nadine Kieran.
Good afternoon. Not bad, but we're talking about a massive, massive, important topic. So I'm going to give you one more try. Good afternoon. Good afternoon. All right, all right. It's an absolute honor to be here today at Gathering Wisdom and to share this space and to share this topic. I want to acknowledge that we are, of course, on the unceded, ancestral, and beautiful traditional territory of the Tsleil-Waututh, Squamish, and Musqueam Nation. Thank you so much for sharing this beautiful, beautiful territory. I want to acknowledge our respected chiefs, health directors, health leads, but really all other leaders as well in this room, because after today, if you stick it out for this session, you're going to leave through these doors expected to be leaders by your community in this topic. This was identified as a priority by your communities. As an oncologist or oncology surgeon, meaning someone who deals day in, day out with individuals who I give this news to, I can understand the fear that Joe was talking about. I've seen it in my patients' eyes, I've seen it in my family's eyes, and I felt a tiny bit of what people like Michael have gone through and are going through. And thank you so much for your bravery and sharing your story. And Joanna, I'm looking forward to yours. I have the honor of sharing some data today. It was done in partnership with the BC Cancer Agency and the First Nations Health Authority, and it took a long time. This was the first time, actually, that we used the First Nations client file in partnership with the BC Cancer Agency to actually start to get an understanding of where we have been as First Nations peoples in British Columbia, where we were trending towards over the years. Because as it became known that this was a priority, in order to develop a strategy, we needed to know where we were, where we are, so we can figure out where the heck we're going. And so I think that this is going to be some really, really important data that can be scary, but I think it carries a message. It was a partnership, and although there's authors on the paper, there are so many other people that were also involved. I want to acknowledge one author in particular, Preston Gounod. Little did we know that as we were doing the edits for this paper, and as we were getting ready to launch and put that into the cancer strategy, that Preston had started his own journey as a warrior against cancer without even knowing it. And Preston lost that journey, but we know that he's with us today. And I want to acknowledge at this time just a moment where we acknowledge all warriors in our communities, in our families that have been on this journey and are currently on this journey, to acknowledge them not in silence, but in applause for their courage. So I've been tasked to share with you this data. So let me walk you through this in a project that was looking at where we've been. So when you look at First Nations individuals in British Columbia using the First Nations client file, you can see on the left is the First Nations men, and then women on the right, looking at the most common cancers. You can see the big three in men: most common, prostate, colorectal, and lung. In women, breast, colorectal, lung, and cervical. Of course, cancer comes in many, many costumes, in many, many different dress. And so you can see that those purple is all other cancers. Those are cancers that are less than 5% of the pie, but every single one of them is something that needs to be battled, and every single one of them is something that needs to be beaten. And I think I need to disclose right now that all this is data, it's numbers, and it is vital, but every single number that we discovered and that we looked at and that we studied is an individual, is a human being, is a mother, is a daughter, is a granddaughter, is a sister, a brother, a daughter, a son. And I think that's really, really important to listen to, because data is so important to understand things, but it's the stories that we gravitate to and that we remember. Of course, that purple in the pie graph, these are some of the others that we're talking about in terms of other common cancers that are in there. But these are like 2% of the cancers, 1% of the cancers, 3% of the cancers. They're not up there so you can read them all. Every single cell in the human body is at risk of turning into cancer, some exceedingly rare, and like we saw, the big three, the big four, some way, way too common. So there's three that we want to focus on today because they are common. They were both in the pie graphs in the first slide that I showed you with the data for men and women. Colorectal, a very common cancer in both men and women in our communities. Breast, although men can get breast cancer, is the most common cancer diagnosed in First Nations women in British Columbia. And cervical cancer, a very common one. Also important about these three cancers is they have established provincial-wide, through the Cancer Agency, in concert with our primary care providers out in our own communities, screening programs. Screening meaning that if you have not a single symptom, that if you meet the eligibility criteria, if you've been identified by studies and research to be at risk for these cancers, in particular at a certain rate, then there are screening programs you can go to detect them earlier so that you're talking about them 40 years down the road, 50 years down the road, or that you could detect them preconditions before it turns into cancer so you can actually prevent cancer. Screening for when you have absolutely no symptoms, but you're at risk. And then you can either prevent the cancer that we're afraid of, that we don't want to happen, or we can actually beat the darn thing if we fall into that gap where we're unfortunate and we have that path and that journey that we're going to be warriors on. So when you look at colorectal cancer, in the top 3 of cancers diagnosed in both men and women in First Nations populations in here in British Columbia, if you look at females, I want you to look at the dark straight line is our First Nations, and the dotted line are the non-First Nations in British Columbia in this study. You can see that in First Nations women, we have a higher rate of colorectal cancer than the rest of British Columbia. Another thing to notice here is that the rest of British Columbia, that line's kind of going down, slightly, but it's going down. But in First Nations women, that line is trending up. We can change that by addressing that screening issue, by moving upstream into prevention and wellness and screening, because that's a trend we don't want to leave our next generation with. In males, you can see that there is a difference as well, except that difference is even greater. And again, although it's pretty static in non-First Nations, in First Nations men, in British Columbia, that trend is going up. We're going in the wrong direction, but the most important thing is we have the knowledge now to know that we are going in the wrong direction, because this comparison, this knowledge has never been available before this study. Now we know the nature of the beast, and we know that we can beat this. There's other 2 common cancers. We talked about the colorectal, and then there's cervical cancer. Again, look at that darn black line. It's above the dotted line again, a higher rate or incidence rate of cervical cancer in women in British Columbia. And you can see again, although it was trending down for a while, it's going back up again. We are trending up. Not only do we have a higher rate, not only is it one of the top 4 common cancers in First Nations women, but that trend is going up. But we have some things on our side. For example, this data wasn't around when we had the vaccination for human papillomavirus, so we can vaccinate our youth to actually prevent cervical cancer. We can increase the screening through the pap smear so we can identify precancerous cells and do something about them. And we can diagnose cervical cancer early so that if you happen to get it, you can beat that, and when you are a warrior on this journey. So cervical, colorectal, what's the last one? I'm testing to see if you're awake. Breast. Okay. Look at breast. What do you see? Someone want to help me out? I think I heard it over there. The black line, our line, lower. Now at first, if you do the math, we call it statistics. If you do the math, it looks lower, but it was roughly the same. But actually, when you look at the far right of that graph, that even mathematically or statistically is lower compared to non-First Nations in British Columbia. So what do? Do we just knock off breast and say we don't have to worry about it? What do you think, Joanna? Remember that pie graph I showed you in the beginning? What's the most commonly diagnosed cancer in First Nations women, in our mothers, in our grandmothers, in our daughters, in our sisters? What's the most common cancer? Breast. And so one of the things is we have to make sure that in this strategy, as we address screening and prevention, what target are we aiming for? Someone else's best? Someone else's optimal? Someone else's statistic? Or are we trying to decrease and optimize our health to the best of our ability in every family, in every community? Are we seeing here what we are hearing about when Joe was referring to Alaska? When everyone in this room clapped and said, we can do that too? Are we looking at this and saying, you know what? We're onto something here. And so what we want to do is look at screening for colorectal cancer, cervical cancer, and for breast cancer in terms of mammography. And we want to realize that we can address this. We know that it's trending down. And what we can do, particularly in this next year and a half when we're focusing on this, is addressing that screening so we can prevent it, diagnose it earlier, and survive it. So these are the 3 cancers that have screening programs: colorectal, cervical, and breast, that have provincially based screening programs. All can help to prevent the cancer, and they can actually help you diagnose it early. If you diagnose it early, do you know what that means to me as a surgeon? I have a very different conversation with that person that is sitting across from me with their loved ones beside them. I have actually, once I give them the news, the C word that we were talking about, I have a message that I can give them saying, this has been caught early. This is something we can do something about. This is something that you are most likely going to be talking about and talking to you and saying, you know what, 20 years ago, I remember this really scary day I had. I can give them really good news, and they can embark on this journey as warriors, knowing that they have this ability and this chance of surviving it because of the screening program that they did. That's greater than if they would have found it by chance or by symptoms because it was advanced. So we're talking about not only preventing, but we're talking about diagnosing it early. So let's go to the other part of the story. Because when we looked at the survival, when we looked not at the incidence, which is basically how many cases are diagnosed in First Nations compared to non-First Nations in British Columbia per year based on our populations, we actually looked at what are the chances of surviving this. If you're First Nations over here, and you're not First Nations over here, just taking that alone, what are the differences in survival? And what we started to look at is to see on very sort of gross level statistics or math or numbers, is that out of the 15 sites that we looked at in women, 10 out of the 15 First Nations women had a poorer chance of survival compared to non-First Nations women in British Columbia. 10 out of 15. If you look at men, it looked even more concerning with respect to 10 out of the 12 cancers that we looked at in men, the survival was poorer. Those are numbers. This was the first study to look at numbers. They didn't capture the stories. They didn't capture the people behind it. They didn't capture the tears, the courage, the wisdom. But what we can do is we can do more research to figure this out. Out there in the communities, you can give feedback to figure out how are we going to address this? How are we going to capture this? How are we going to realize what are the barriers so that we can change those trends going up to trends going down? We can change the ultimate incidence from something that's high to something that's way lower. And we can change who survives and the numbers and the likelihood so that when you embark on a cancer journey, you know that the journeys that were of yesteryear are nowhere like they're going to be in the future because we could do something about it. And so that I'm going to leave this off to now our wonderful Shannon, who's going to explain how now the cancer strategy is going to figure out how we, as First Nations individuals, communities, and leaders, can actually employ this strategy to change these numbers for good. Chi-miigwech.
She's a tough act to follow. Cancer's a scary thing to me. My mom was diagnosed with breast cancer at 48. She died at 53 and didn't live to see her second grandchild born. My dad, who liked to have a drink now and then, I'll be nice, and who was a 2+ pack-a-day smoker for most of his life, was diagnosed with a community-acquired pneumonia in March. Got a call from the hospital radiologist the next day and said, "Come on back." And he had an inoperable lung cancer and died 6 weeks later. Them's ugly genetics. So, I'm really interested in how to make sure I can respond to that in a way that's healthy. I used to smoke. I don't smoke anymore. I get my boobs squished once a year since the time I was 40. And I have had more than one colonoscopy where they actually found polyps, which is why I have to keep having them. They weren't cancerous, but they were there. Scary. But I will go back as often as I have to go back to be around to hang out for my grandson's high school graduation. So my cancer story is not unique. And we have heard from the time I started doing this work all across the country, coast to coast to coast, communities saying, we never used to have cancer like this in our communities. We never used to see it. People are dying from cancer at furious rates. One lady told me that there was 6 people on her street who had been treated for cancer, and she wanted to know why. And we've done lots of different pieces of work trying to figure that out. But we really wanted to know, and in hearing these messages over and over again, when it came to previous engagement, there was some cancer-specific opportunities for people to tell us their stories, to tell us what the path was that their loved one took, and what we would need to do to make that path an easier one. There it is. How many were at Gathering Wisdom in 2013? Does this look familiar to anybody? We were actually given these river maps to place on those stones some of the stepping stones through a journey with cancer, and to encourage people to tell stories about those different stages. And some of them are early, the knowledge development piece, and that's work that will go on. The more knowledge we have, the more we will share. But we also need the knowledge from our community partners on what's working and what's not, what the fears are, and what we could possibly do to alleviate them. We can't do that alone. We have very, very important partnerships with care providers, with physicians, with BC Cancer, with you in community. Without those partnerships, we won't be able to do what needs to be done. Before I get to the screening stuff, I want to take a leap over a couple of rocks to cultural safety. Because it looks on this, if you're thinking of this as water going down a river, like cultural safety's way down in the story, and it's not. Cultural safety is about, do people feel safe even going into their family doctor and saying, I got a family history of cancer and I'd like to make sure everything's okay. Or I have never had a pap smear. Or how do I go about getting a mammography done? Those are conversations we all need to feel safe to have. So cultural safety is about feeling safe, feeling like people are behind you and a partner in whatever health and wellness journey you're on. We really want to talk about relationship-based care. Our work at First Nations Health Authority is so relationship-based. And if we don't get that right, we don't get the other things right either. And lots of patients and family members said they wanted more information about emotional, social, educational, and cultural resources to support them in their journeys. A good friend of mine and the stepmother to my dogs, when we came back from vacation where she'd been caring for my home and my dogs, the first thing she said to me when I walked in the door was, "I have breast cancer." But the next few months of her journey, through surgery, through supports from BC Cancer, through engagement with other cancer patients on their journey, through involvement at the Y, other things that her nation helped to support her on, she is not only now cancer-free, but she's stayed on that wellness journey to try to make her entire self healthier. Also want to talk about screening, of course, and there are lots of opportunities here over the next couple of days for people to have conversations about screening. Screening is fabulous because it means if you're screened, there's something we can do about it. And as physicians, I think the thing that's most heartbreaking is when people like my dad walk into an office for a first cancer diagnosis to be told there's nothing we can do. No surgery, no chemo, nothing would have made a difference. And he chose at that moment to say, okay, I'll stay home as long as I can. And he only lived the last 4 days of his life in hospital. He made choices about the end of his life, but so much of that could have been prevented. I kept thinking, he'd had a cough as long as I could remember. And I kept thinking, when did he have his last chest x-ray? Before that community-acquired pneumonia. What were those things that we could have done? Well, we know that with breast, colorectal, and cervical cancer, we have funded, simple, accessible, relatively pain-free, the boob squish is not the greatest, ways to discover that, first off, you're cancer-free. You get a letter in the mail that says everything's fine. Or that there's something that needs to be looked at more closely, my polyps, and let's go back and take another look. So there are lots of things that can be done. I am standing here saying I don't have colorectal cancer. I know that, and I'm going to keep an eye on things. It's easy to do. How many of you have been up through the blow-up colon upstairs? The giant colon? Come on, everybody's got to have a selfie in that thing, right? It really does help the conversation to be understanding about what is out there. And we have rooms here that are on your calendar. There are the team of doctors from FNHA who are supporting conversations, and we really want to be able to encourage all of you to be knowledgeable for yourself, for your family, and for your community. And finally, the end-of-life discussion versus survivorship. Nadine has already talked about the joy of survivorship, but it's not an easy journey. You know, going back and checking, making sure, and the time between visits in survivorship get further and further and further apart. But I don't think that shadow ever completely leaves you. But you have an opportunity as a survivor to tell a story like Jonas is going to encourage everybody. And when none of that works, I think Indigenous communities, in a way that nobody else does, talks about a good death. And we need to talk about a good death. What do we need to do to support people at the end of their life to be able to get to the next world in the most comfort that's possible? So this lovely document, I don't know if you can see it, there's a bunch of them out there, is the Joint Indigenous Cancer Strategy. And it's a piece of work based on that research that Nadine talked about, response to the findings we heard and the stories we heard through engagement. And it is a joint piece of work between FNHA, BC Cancer, Métis Nation BC, and the BC Association of Aboriginal Friendship Centres. So our families have been involved no matter where they are. And the strategy provides a roadmap for us at FNHA and our health system partners to improve those cancer journeys in BC. So just a quick flashby, because you've heard it once, but I'm going to remind you. The colorectal screening program has 2 stages. Screening is about somebody that doesn't have any symptoms at all. So if there's blood in your stool, you have a symptom, different pathway. But for those of us who are a little older, 50 plus, to go in from your doctor and get a fit test. And a fit test is something you do at home. You get a little sample of your stool, and it gets sent in. You may not be able to see it, but there may be blood in that stool that they can pick up under a microscope. That's what they're looking for. It's kind of embarrassing, it's kind of gross, but it's not that bad. And then if something is found on your fit test, you may be asked to consider a colonoscopy to look for polyps, to look for growths that are early stages of cancer that can be treated at that stage. So the cervical screening program, and I almost want to take a flip back. Your uterus is kind of like a big, okay, some of you have a uterus, an inverted triangle. But when we do a vaginal exam and we use the speculum, gotta love those things, and hopefully you have a doctor that warms them up. What we can see when we look inside the vagina is only the tip of the uterus, the cervix, the lowest part. And those are the cells that can be most affected by human papillomavirus. And when we do what we call a scraping, we take some of the skin cells from the cervix. When we do a pap smear, we put them on the slide and send it in. We can see when those cells are looked at whether or not the cells are fine, whether they're precancerous, or whether there's obvious cancer. That's what they're looking for. It is uncomfortable, kind of embarrassing. I've had a whole bunch of kids, so having people in the room with feet up on stirrups isn't anything new. But it's something that you should be doing regularly. Women between the ages of 25 to 69 should be screened for cervical cancer every 3 years. They figure by the time you're 69, you're pretty much done. I hope not. I'm getting darn close to that. And finally, the breast cancer screening program. I get my regular reminders always close to my birthday. It kind of became a thing, but it helps me to remember because I know I'm going to end up getting my boobs squished, usually just before we go away, so in the winter. And BC offers breast screening free mammograms for eligible women in British Columbia between the ages of 40 and 74. And if you haven't already, go take a look at the van outside, which will help you to understand what the equipment's like. So there's the roadmap, the strategy, and we're moving that forward. Oh, there it is. I was looking for that. And, oh, we're all done anyway. There's our joyous little blow-up colon. So I think it's great. It's so much fun. I always wanted to be poop. So, when you run through it, and never mind. There's just some things girls should not talk about. Okay, so I think one of the interesting things about it, when you stop laughing, is to actually look and see the difference between a non-cancerous polyp and a precancerous lesion, just to get an idea of what they'd be looking for. If it's any consolation, if you go for a colonoscopy, they give you a little happy juice, so you may not be out cold, but you're kind of stoned for a period of time. Always take an extra driver with you. And it doesn't take very long. It's only a few minutes. So if you are asked to go, as kind of scary as it is, they make it as comfortable for you as possible. And hopefully what they find isn't anything frightening. And if there is anything concerning, it is usually something that can be fixed. So that's why we do it. So breast cancer, cervical cancer, colorectal cancer, let's get out there and move forward on the screening so that we don't have the statistics about survivorship that Nadine talked about, that we're diagnosing people early or preventing them from being diagnosed at all. So thank you.
He's going to stop you.
Hello, everyone. My name is Jonas, Beryl, Crawford. I'm from the Musqueam Indian Band, and I am here today to tell you that I'm a very grateful woman. I have someone sitting right across from me on her cell phone, probably checking at the office. Corinne Point, I like to call her, and her team brought a program into Musqueam in 2013 at the very end of the year. And I was working for the band at the time in the protocol department, but I had a very, very sick mother that was just starting to get very frail and become very ill. And I was consumed with her, and so much so to the point where I didn't really look after myself and take care of what BC Cancer Agency was then promoting. A lot can happen in 2 years. And in those 2 years, it happened to me. And I was sitting in my office working, and this young woman kept coming into my office. She phoned me the night before and said, "We're going to launch a program tomorrow, and we want you to come and have a mammogram." And I said, "Sure, no problem, I'll come and do it." Not realizing it had been 2 years since I'd had my last mammogram. I normally would go every year. But because my mom was so sick, I neglected to go. And in that 2 years, I was the one who got the breast cancer. I was really, really shocked and really surprised because, I walked into the room and I thought to myself, this is kind of primitive. Like, they've got little tents and doing x-rays just like we used to when we were kids, and they would come in and do testing at our gym. And so I thought to myself, well, I'm going to go in and do it. But, it took me a while to get going and to get in there because I was so busy at work that day. She came into my office 3 times. And what a lasting impression that made on me, that she would not give up on me. I kept saying, I'll go, you know what, I'm just going to go myself. I don't need to go there. I can go and I'll get it done myself. And I'm going to tell you from the bottom of my heart, had she not done that, where would I be now? If even here. She didn't give up. She kept saying, "John, I want you to do this, and I'm taking you with me right now." So I went in and I got it done. And I think it was about a month later, somehow I didn't write my phone number down properly, and they had a hard time finding me. And I went back, and my doctor called me and said, "You need to get in, and they want to see you." And over the years, I'd always had that kind of experience where I would get callbacks because I had these very dense breasts that were hard to do mammograms on. So I thought it was fine, and I was pretty excited, thinking to myself, I'm fine. I'm going to go and get this done by myself. I'm not worried about this at all. I'm going to be just fine. And I got there, and she said, "I'd like to do a biopsy on you." And I said, "Right now?" And she said, "Yeah, right now." So I took my phone out, like we all do, and I videoed it. And I was sitting there thinking, well, I want to understand what she's doing, and I want to know what's going on in my body, and so I'm going to do this. And I videoed her doing the biopsy. And then she looked at me and she goes, I want this out. I want you to call your doctor, and I want you to make arrangements right now to get this removed. And I said, do you think I have cancer? And she said, I absolutely think you have cancer. And I went, oh my God. So I went out into the car, got in the car. As I was getting into the car, all of a sudden I felt like I was going through an earthquake. I was like, what am I going to do? How am I going to go tell my 4 kids? How am I going to tell my family? I had never felt more spiritual in my entire life. I felt more connected to the Creator at that moment than I had ever felt in my entire life. I felt like I was floating. I felt like I was lifted up. I felt like I knew that I needed to get this together, and I needed to figure out a plan, and I needed to take charge because I have 4 kids at home. I have my mom I need to look after. I come from a family of 10, and I'm number 9. And nobody in my family had ever gone through anything like this before other than my brother, who had passed away from colorectal cancer about 10 years ago, which could have been prevented 100% if he wasn't afraid to go to the doctor. And that was the lesson that I learned. Don't be afraid. Don't fear anything, but you have to get it together, and you have to get out there, and you need to find out a game plan. So I did, and I went home and I talked to my kids, and I told my kids that, you know, this is what we're going to be faced with, this is what we're going to do, and we're going to have a good attitude, and we're not going to sit and have a pity party, and we're not going to sit there and give up on this. And so I had this amazing, wonderful friend that I raised my kids with at school, and she became my cancer cop. And she came to every appointment with me, every single doctor's appointment. My sisters were so mad. They were like, what are you doing? Why can't we do this? You know Wendy. Wendy is not an easy one to deal with. And so I'm sitting there trying to go, I can do this, Wendy. I somehow needed to shield myself, protect myself, figure out my plan. And I knew my family didn't know enough about cancer to know how to lift me up in this situation. I was the one who looked after my brother. Him and I were really, really close. And so I walked through every step with him and tried to learn as much as I could. We did fundraisers for his cancer treatment that they didn't offer in Canada. You know, we did all kinds of things to try to help him survive another year. Not the best quality of life, but he stayed for another year, and I was grateful for that. So it taught me a lesson about attitude as soon as I was diagnosed. And Brent was always afraid. I could see it in his eyes. I could feel it in his heart. I could feel his spirit, that he was afraid. He didn't want to face it head on with an attitude of, I need to get to the bottom of this and do the best that I can. He was sick for a long time, probably about 10 years prior to even his diagnosis, because he was a man, he was a fisherman, and he wasn't going to go get it done. Guys don't do things like that. And so I learned a lot from him. And I thought, now that it's my turn, I have to figure out how to deal with this treatment, and I have to deal with how I'm going to make myself better again. Because I literally had no symptoms, other than my one son saying to me, Mom, you say you're not well all the time, that you don't feel good, and you were tired all the time. And I didn't realize that. I had no idea, because I was just pushing myself, and I thought I was tired from looking after my mom. I didn't think that I had a health issue. And so when I finally got in to see the oncologist, and I saw my surgeon, and I created a game plan, it went into place so fast, my head spun. I was diagnosed at the end of November. By December, I had a surgeon to see. I had a doctor to see. By January the 7th, which, by the way, was the anniversary of my brother Brent's passing, I was being set for surgery. And they had a cancellation while I was in the room with the doctor. So within 5 days, my cancer was removed. And Dr. Kusk looked at me and said, this is a glitch in your life. Deal with it with a good attitude. And that's exactly what I did. I turned around and said, I'm going to take charge of this, and I'm going to figure this out. And one thing that I was really grateful for was I learned from the cancer agency that there was a test that was offered for breast cancer, and I believe it's for colon cancer as well, the Oncotype DX test. My numbers came back to me at number 9, which means I didn't need chemotherapy. I needed radiation. I rode my bike there, I walked there, I walked home. I prayed and prayed and prayed, and I asked for the strength to be positive. And at the end of the day, this is 4.5 years later, I've got 6 more months left of tamoxifen, and I'm ready to be off of it, because if any woman in this room knows what a hot flash is like, that gives you the best hot flash you can ever have. And so I'm ready to be over it, and I'm ready to take charge, and I want to be of any support that I can to help anybody. And I'm grateful to the First Nations Health Authority for creating this program, and that the BC Cancer Agency has asked me to be the spokesperson for the traveling mammography program. I want to give back because I know that every cancer is different. And if there's a good cancer to get, I got a good cancer. So I'm grateful for that, and I'm grateful to be here. I'm thankful for the opportunity to speak, and I'm thankful to our health department for taking the initiative long before the program was initiated, and to take care of our women in our community so that we can stand in front of you today. So with all my heart, thank you very much, and let's all fight.
Can I call upon our panelists for the announcement? Grand Chief Doug Kelly, of course, Colleen Erickson, we've got Kim Brooks.
First, I want to thank Beverly, Michael, Jonah for their powerful testimonials. They shared history, their history. So powerful. We've all had someone in our family. My wife's had her experience. My brother had his. They're still here. My uncle, he's not. And when Uncle was diagnosed, instead of kicking himself in the rear end with the time that he had left, he kicked all his nephews in the rear end to go get the finger up the bum, to do that screening, to get, in his case, the PSA. He kept pushing us really hard. And that's what we want to do. This campaign is to make sure that we as leaders, elected, appointed, hereditary, that caregivers, health directors, those that are working with our citizens on a day-to-day basis, learn as much as we can to encourage our family members to get screened, to do what Jonah talked about, put away the fear, and know what you need to do. And so I just wanted to thank you all for your presentations and your information and your encouragement, your advice, to support the announcement, and to let you know that there's going to be a recognition ceremony at the next Gathering Wisdom in 18 months' time in the fall of 2019 to honor and recognize those individuals and communities who have become true champions for cancer screening in their regions. There will be 5 prizes of $5,000 will be awarded to those communities who truly champion this cause. Thank you.
Greetings, everybody, and thank you, Doug, for your words. on this vital topic. Sorry, must be getting the awards at the end of the day. My name is Colleen Erickson. I'm Lucille from Nakasley, and I'm also the chair of the Board of Directors of First Nations Health Authority. As noted earlier, this campaign challenges us as leaders of our committees and communities to seek knowledge. I think it's so key about the various screening programs and guidelines. Get screened ourselves if we fall within the guidelines, and that is so important. And I think that, because so often we think, well, I don't fit in that category, I don't fit in that category, and we just kind of ignore the whole process, and it's easy to do. And so, we need to encourage and support our families, friends, and communities to get screened as well. Very critical. And we're hearing that for various reasons, our people are not detecting preventable and treatable cancers early enough. While it is important to continue focusing on wellness and prevention holistically through living healthy lives, we must also view screening as part of our overall wellness plans. As partners of the Indigenous Cancer Strategy, we released with BC Cancer, Métis Nation BC, and the BC Association of Aboriginal Friendship Centres, the FNHA is committed to raising awareness of colon, cervical, breast screening programs, doing our part to increase accessibility to cultural safety and trauma-informed screening, and ultimately increasing the numbers of our people participating in screening, both those who are living at home and those living away from home. I look forward to seeing this campaign that Doug mentioned and the challenge to come alive through the participation of our leadership. People see us out in the community, and so we need to lead as champions also. As Doug noted, part of this campaign is a community challenge launching today, and in addition to the 5 community prizes, we will be honoring 2 individuals in each region in 2 categories. The first category, first-time screener, and the second, screening champion. Each of these individuals will receive $2,500 in prize money and be recognized at the next Gathering Wisdom. I look forward to reconnecting with everybody in Gathering Wisdom 10 to celebrate our screening champions. In the meantime, be sure to visit our online portal, screenforwellness.com, where you can log on and share your stories. And it's really important that we share with one another. It's really good to hear Jonas' story and the stories that we hear individually, because like I said, so often we feel as though we're on this journey alone, and we're not. It's simply reaching out. And when I think about like even the journey that we had as a family when my mom passed of cancer when she was 54, it was very much, and it was 35 years ago now, and the journey from all the awareness that happens today, the journey is much different. And there's so much help out there, so it's really important to reach out for it. So we're excited, to follow along with your screening journeys, and we'll be watching for the champions. And thank you all for this afternoon, and I'll pass it over to Kim.
Thank you, Doug and Colleen, for your words, and thank you to the panel for setting the context regarding the importance of this campaign, for sharing with us with humor, and more importantly with truth, by showing your vulnerability, but also in doing so, showing us your strength. So thank you for doing that. I'm pleased to support this launch on behalf of the First Nations Health Directors Association to share in announcing this cancer screening campaign and challenge for our people. I'm thinking about Joe's words earlier today, Michael's, Jonas. It's reminding us how important it is for us to practice self-care and really self-love. Of course, self-care comes in many forms, and today we're talking about getting screened for cancers and encouraging those in our lives to do the same. This campaign aligns so well with our First Nations Health Directors Association Head to Heart campaign, where the pillar where we talk about weaving networks of support, where we encourage our health directors and all leadership really to connect with our professional peers, our families, our friends, and to support one another to stay well and balanced together, and ultimately support one another to live healthy lives. Health directors and leaders, we know all too well the reality in our communities. What affects one of us affects all of us, which is why you will find health leads and their teams working so hard in community to support people in their wellness planning and to be proactive by encouraging regular checkups and screenings for all members in our communities. I appreciate the 4 points embedded within the Screen for Wellness campaign, which uses really an Indigenous cultural lens and reminds us why we need to screen for cancer. Screen for wellness, screen for family, screen for community, and screen for wisdom. I did them out of order, but one was I got all 4. The messages are simple. By using our inherent wisdom, being proactive, encouraging everyone in our families and communities to get screened, doing so ensures optimal wellness. Again, I urge every leader here to be part of the screening campaign. You can do this by learning more about the cancer screening programs for the 3 cancers we heard about today and how they affect our people, by making regular screening a part of your wellness journey, by being a source of information for people in your community to learn more about cancer screening, making cancer screening a regular topic of conversation in your community, at your family gatherings, with those that you love. I also encourage all health directors and leads to attend one of the Screen for Wellness breakout sessions tomorrow, take part in the various on-site activities. I know our community, we know by previous campaigns, we could say Beefy Chiefs as an example, we all are up for a little healthy challenge. And I know there's some competitive folks in this building and in our communities. So I'm really excited, and I'm hopeful that this campaign will result in you going back into your communities and being champions for this kind of work, seeing our families and communities across the province participating in the challenge. I look forward to seeing you all at Gathering Wisdom 10 when we announce our Screen for Wellness champions. You can also go to screenforwellness.com and encourage your community members to share their stories on social media. We're learning that's a really useful tool for us to share the good stories, to share the good work that we're doing. And I want to thank you all for being here and taking the time to hear this panel at the end of the day. Together we can have a real impact for wellness in our communities.
I'm being nice, I'm letting him speak first.
First and only time, I'll tell you that.
Apparently it's the last time too.
And it almost didn't happen. Thank you, Colleen and Kim and Grand Chief. As our speakers noted, Screen for Wellness, screenforwellness.com, or CA, did I make it? When is COM, CA? I made a mistake, sorry. Screen for Wellness campaign is an opportunity for you to seek wisdom before there are symptoms in order to help take care of your overall wellness. It's also a way for each of you as community leaders to lead by example and show how to care for yourself, your family, and your community. And remember that a cancer diagnosis of one of us affects all of us. I'd like to share a couple of personal remarks. and based on my experiences, and no matter what, whether it's cancer or anything else, you have to be your own best health advocate. You have to push for answers. If at all possible, bring a partner, bring that cancer cop, and if at all possible, be that partner, be that cancer cop for somebody else. Talk about it. Share your stories. Don't let fear or embarrassment put your own health at risk. Look, I'm embarrassed that most nights I have to wear diapers to bed. I'm embarrassed that my penis resembles a shriveled up little gummy bear. But I'm not ashamed. I'm not ashamed that I have cancer. I'm not ashamed of what cancer has done to me. There's no shame in me. There's no shame in my disease. But I'm going to fight it anyways. Be an effing cancer warrior.
Michael wanted me to take my shirt. Yeah. Yes, Michael wanted me to take off my coat. That's what friends are for, I tell you. I just want to add a couple comments add to what Michael said. He said, you know, be an advocate for yourself. But I want to say that with my parents could not ask the questions to the doctor, the cancer doctor. I went with them because my dad, the first time he went, he didn't want anyone there. But the next time he went, they asked me to be there. My role was to ask the tough questions. Bring someone with you, like Jonna brought her sister, brought her friend. My parents brought me. Michael's wife goes with him. Bring someone there. There are times that these conversations we mentioned is a very hard conversation to have. And sometimes it's hard to have them with your friends. Sometimes it's hard to have them with your family. In those cases, there are times where I was talking to a woman the other week. She said, my friend has cancer and he doesn't want other people to know. I don't have anybody else to talk to. Because in her community, her friends were his friends too. So in those cases, reach out. Sometimes it's outside of your normal community to ask those questions, to have those conversations with. But when my dad had cancer, I looked for people to talk to. Michael was obviously one of them. And I did look for groups. In your community, as Doug and Colleen and Kim mentioned, start those conversations. The challenge is out there for you to be the champions in your communities. As leaders and leadership, you've got your community solutions. Create solutions that work for you. There are five prizes. Come back and share those smart practices with others. Challenge your people in your community to go out and get that screening. For the first-time screeners, the second-time screeners, it helps a lot. In February, my mom called, and she said, Erin has cancer. And what does that mean? What does that mean? By the way, Erin's good. She's had the surgery. Things are looking good. But that means for me, now I get to go in for an annual pancake booze squeeze. So lucky me. Yahoo! Actually, I'm happy to go. Because the people, by the way, our healthcare providers are amazing people. What a challenge and a great thing you do. You help to ease people's pain and help to understand the journey that they're on. Thank you guys. You guys are amazing people. You make it a lot easier when it's very tough. Your work isn't done, though, when you go home. You have some work to do here. As Kim and Doug and Colleen mentioned and the doctors mentioned, we've got a lot going on here at the conference. We want you to remember to screen for wellness, prevention, wisdom, and community. We've got information sessions that start tomorrow. Start those conversations here on prevention and screening. We've got the wellness room, which is right next to the vendor's room. It's on this level. Here's a chance for you to tell your story. Telling your story has helped other people to have those conversations. Take a photo. There's a booth there for you to do that. Gather a shirt. It won't be this one. I'll still be wearing it. But there are shirts for you as well to remind you for Screen for Wellness. There's an opportunity as well to collect the buttons. You'll see some of us wearing them. The blue, teal, pink, there's 4 of them. Those buttons are at the different locations to encourage you to go around. There's also a draw for Michael's book, Finger Up the Bum. Yes, thank you. So there are a few copies of those books. They also mentioned, Dr. McDonald and Dr. Kieran also mentioned, there's also the mobile mammography van. It's actually going to be here tomorrow and Thursday. Please go out and check them out, because some of you, I know, you want to check out those boobs. The other thing is that they also showed an image of that giant-sized colon. Go check it out, but apparently that's actually the medium-sized colon, because they didn't have room here for the biggest ass. Apparently it wasn't available. And for those chiefs out there, this is a chance for you to get into shit, the right kind. I worried about saying that word. But it is the right time. Go in and check it out. For those of you, you know some people that they only go up to their nose. It's the time for them to get in there the full way. And we'll also see around on the floor people with iPads. Those, go and ask them. They'll help you register online. That mammography van is going to be going around the province. Find out when it's going to be there. Get registered. And also at the information tables, which is there's one right out the door. There's also this community resource guide. These guides are amazing. There are times that you don't know who to talk to or where to go, and there are a lot of resources and support out there for family, for friends, for the people that are facing that cancer journey them on. So this is a great resource guide. There's copies available. And I also want to remind you of some of the comments that we've heard, and that is, Dr. Kieran, thank you for saying and showing the statistics, showing that we can make a change by becoming aware through the screening, through the research, and we know we can beat this. Thank you. Thank you, Dr. Kieran. And for Dr. McDonald to remind us that there's cultural support out there. Thank you. And around the room, too, we've actually on site, we've got traditional healers. For those, I know this is tough, but there are traditional healers available for you to talk to. Like I said, there are friends and family, and there are also people outside your immediate community. Again, be knowledgeable for yourself, for your family, and for your community. And for myself, thank you for being here today and for sharing and for listening to our own personal our personal journeys and our stories. And please make your future course a positive one. I'm going to ask Harold to now come up, and apparently he promised at lunchtime some very inspirational and wise comments. So as he's closing off the day, Harold, the podium is yours. And thank you to our panelists. Thank you.